Hello, and welcome back to 10 Minutes With. Today I'm joined by Zhana Chokeli to discuss creating a new rare disease national alliance. Thank you for joining me, Zhana.
Hello, Ria. Thank you for inviting me.
My pleasure. Thank you for
for the
joining us.
opportunity.
So, could you start by introducing yourself to the people at home? Who are you and what do you do?
So I'm Zhana. I'm from Georgia, a country in the Eastern Europe. My son has rare disease caused by the mutation of SCN2A gene. He started seizures very early, from the third day of life, and doctors couldn't find out the reason. They tried different drugs, and after 3 months, we find out that he had SCN2A gene mutation. And the first 3 months was horrible for us. We didn't know what to do or where to go. And fortunately, we were lucky enough to find the right doctor who insisted us to do genetic tests, and we are lucky on this point. And after diagnosis, we thought, okay, so we know the reason and we will have all the answers, but that was not the case. And it was, we had more questions after diagnosis and no answers. So we wanted to know whether there was a treatment or what his future could be. And the answer was no, we don't know what his future would be, and there is no treatment. And then we started searching for the answers, and that's how I find families with the same diagnosis. And it was a great relief for us because we thought we were alone. We didn't know anyone. No one could understand us because you won't understand a parent or a child who has the rare disease if you don't came across with this disease.
Of course.
And it was a great support to find the families. And then I realized that I had to establish an association, SCN2A, Georgian Association, to represent other SCN2A kids from Georgia. So our voice to be heard more louder. I wanted all the doctors to know the symptoms of SCN2A, so no other family would suffer like we did during these 3 months. And the diagnosis really helped us because his seizures were stopped because we already knew what was the right treatment. And that helped a lot, because our previous doctor would insist that diagnosis was just a name, but it's not that case. The diagnosis is not just a name; it's a real help. So you know that what causes the symptoms, and in future. Then I find out that there is a pharma company that is working on a treatment, on a cure. I get in touch with them, and now I had hope. And hope gave me so much power that I realized that I could do more.
You're so right. And that's such an incredible story to go from not even knowing what advocacy is to being the leader of your own patient advocacy organization. What steps have you taken to develop the organization since it first started as that coalition of families? And what are some of the things that you're most proud of?
So I'm proud of establishing the alliance, of course.
Of course, yeah.
Yes, and when I realized that there are several patient organizations, there are about 20 patient organizations in Georgia, and they're just dealing with their own diseases, discussing doctors who is better or who is less competitive, and they're just, I don't know, posting some news about their diseases, for example. So they're just communicate with each other. And this does not change anything with the Minister of Health or something. So they are not focused on rare diseases. So I wanted to join forces to make Georgian health minister to make rare diseases a priority of the health system. So at first, we are now five patient organizations and one patient representative. So we are 6 now, and we're focused more on educational part because if we think that patients should be educated to advocate for themselves. Some of them don't even know the name of their own diseases because of these language barriers. They don't speak English, and most of the resources are in English or German or French or Spanish. So in Georgia, there is very
that's a major problem, is it?
Yes, that's a major problem. And if you are lucky enough to speak English, so you can have resources, but we should be equal, right? Everyone should have the same opportunities. And that's why we started some educational part right now. So we are posting some general information on rare diseases in Georgia. And on specific diseases as well. So we want to try to translate as much information as possible. And in future, we are planning, for example, to make some educational webinars or some educational meetings for not for only patients, but for doctors as well, for pediatricians. Yeah, and we are working on some mental support program as well. So we want to have some hotline or some web page where patient representatives can get some support because only 3 words, I know what you feel, can make a huge change for that families. And I know it from myself because it's how it worked on me.
So you've mentioned there already both education and also kind of alluded to mental health.
Yeah.
I presume those are two of the major ones, but are there any other challenges that patient organizations in Georgia are facing?
Well, of course, it's the diagnosis delay, of course, so we want to address this as well, because some patients are waiting their diagnosis for several years. And so we were lucky to find the right doctors, but others are not. So it's not equity. So we should be all equal, right? So we all have the same opportunity, and so that's then another challenge that we want to face.
And so obviously you've grown this national alliance from your own patient organization to now being an alliance of several patient organizations. What would you, in your wildest dreams, how would you like to see this organization having grown in, say, another 5 or 10 years? Big question, well, I know.
Yeah. I haven't think about that too much because it's still we're still starting. But
for the people at home, how old is your national alliance? Just for a bit of context.
It's about 2 months.
Very young.
Very young. But we started working on this, of course, earlier. So we were translating this information, posting and trying to get in touch with patients. So it's not so young. And well, we think that our biggest dream is that we will have some centers, rare disease centers, educational and some therapeutic centers, where rare disease patients would get mental health support, educational support, and also some physiotherapies and so on. So this is our dream.
So even though your national alliance is very young, what are your priorities at this moment?
Of course, national plans of rare diseases.
So important.
Yes, it's really important because I was the part of the working group. We have worked on national plan since 2022, but it's not still established. So it's already should be renewed and changed in this period. Already 3 years passed, and I think that the national plan really matters. So we should know the plan. What steps should take to improve lives of patients with rare diseases.
And so for European policymakers, obviously you've already alluded to the fact that countries in Eastern Europe face specific challenges. Maybe that's due to translating in resources into their languages or making educational resources available to their membership. What would you ask policymakers at European level to do to support people living with rare diseases, specifically in Georgia?
Well, I think the orphan drug reimbursement is a great challenge also in Georgia because families have to wait for a drug to be on the market for 10 years or more, and then you have to wait another 5 years for the government to reimburse it. And I just want to make some steps for the government. So they should have some rules. What should we do before we get reimbursement, and some protocols maybe. I think that we have a lot of job to do in future.
So for the people at home, what can they do to help raise awareness, obviously of rare diseases in general, but maybe specifically for people at home in Georgia?
Share their stories, to start talking to their neighbors and to the people they don't know. But So this is really important. Sharing really matters, and it really can change everything for rare disease patients.
Definitely. And what would be your advice to countries where there isn't yet a rare disease national alliance, but people either are looking to form one or people want to create their own momentum in, for example, a rare disease national plan?
I think they should try to find the right patient organizations, because it was really challenging for me to find people who were really interested in creating the alliance, because this was my third try actually, because I tried twice before, but it wasn't possible because well, everyone wanted to be the part of the alliance, but then when it came to actual actions, no one wanted to participate. So they had their own jobs to do, and they couldn't leave the kids, and so there was several problems. And now I feel that all the participant organizations that are now in the alliance, they're just perfect. I don't know how I could find them, because we don't even have to tell them that you should do this part of the job, and they are just doing it by themselves. I don't know how it happens, but we are a great team. So I think that it's really important to find the right people who are interested in doing the job to improve lives of people with rare diseases.
Definitely. I mean, it's a huge achievement. Congratulations. And we're very excited to see what you have in store in the future.
Thank you so much.
Thank you for joining me today. You've been watching 10 Minutes with me, your host, Rhiannon Walls. Make sure to tune in next time.